Hi friends, how are you? Welcome to my YouTube channel D&D Pathshala. In this video, we will discuss regarding the first aid treatment that which should be given for a hypoglycemic patient. So let's get started with our video. First of all, we will see the definition. First aid is the initial, immediate medical assistance or the treatment which is given to a person who is suddenly ill or injured or in emergency situation. And the person who provides this first aid is known as a first aider. And coming to the history, September 12th is celebrated as World First Aid Day to increase the awareness and also to increase the accessibility on the first aid. And coming to the history, the founder of modern first aid is Frederick S. Mark, and the first aid kit was released by Johnson & Johnson Company in the year 1888, and the first commercial detailed book, that is titled as Handbook of First Aid, was published by the same Johnson & Johnson Company in the 1901. So this is the first aid book, Handbook of First Aid, that which was published by Johnson & Johnson Company, and this is the first aid box which is from the Johnson & Johnson Company. So let us discuss the blood glucose levels and their interpretation levels. These are mg per dl levels and these are mmol per liter levels. So coming to here, in this video we will be discussing regarding the hypoglycemia. So let's see the hypoglycemic values. So if it is less than 17 mg per dl or less than 3.9 in mmol per L, it is hypoglycemia. And when it is below 53 and below 3, that is mmol per liter, it is severe hypoglycemia. So we have to react in the severe hypoglycemia in a very immediate state. If it is in an emergency condition, we have to react very emergency type of manner. We have to react in an emergency type of manner. So now coming to the hypoglycemia. So first of all, before going to the hypoglycemia, we have to discuss regarding the glucose in our body. So the glucose is one of the main energy source that which is obtained from our body, and this is the glucose molecule, and the molecular formula is already known, that is C6H12O6. So first of all, why this hypoglycemic condition occurs to a patient? If the blood glucose or the blood sugar levels go down, that is below 70 mg per dl or 60 mg per dl, these are the hypoglycemic condition, the diagnostic criteria. So how this blood sugar level goes down? If there is any imbalance that which has occurred between insulin and sugar, or if the insulin sugar's balance is incorrect, then hypoglycemic condition will be developed. And this hypoglycemic condition is mostly common in type 1 diabetic patients and also in the type 2 diabetic patients. And some of the other causes are if excess amount of activity, that is exercise activity, is done, or if alcohol drinking is done, or if the meals are skipped, and the liver disorders like hepatitis and also the kidney disorders and adrenal gland disorders. So these are some of the causes. And you all may ask that how this alcohol drinking may affect this hypoglycemic condition or may cause the hypoglycemic condition. In our body, if the alcohol is present, our body will be struggling for more digestion of the alcohol. So the struggle of more digestion of the alcohol, and to digest the alcohol in a very easy manner, the glucose will be consumed more. If the glucose is consumed more, then the most of the glucose activity will be going in the digestion of alcohol. Then the regular glucose for remaining activities will be decreased. So the alcohol drinking will be also a factor for hypoglycemic condition. And most of the diabetic patients will be carrying their glucose testing kits or monitoring kits. So for us to, in any kind of emergency condition, they can monitor, and their insulin pens or any other diabetic medication, so that if any emergency condition occur, they can immediately take. So how to recognize a hypoglycemic patient in any kind of situation? So we can recognize a person or a patient who is in a hypoglycemic state by the signs and symptoms. So what are the actual differences between signs and symptoms? Means the signs can be observed by the other person and the patient himself also, himself or herself. But the symptoms can be experienced by only the person who are suffering with such type of condition. So how to recognize? Means the symptoms or signs like fainting and weakness, confusion, irrelevant behavior, palpitations, tremors, cold and clammy skin. Clammy skin means wetty type of sweaty skin. with rapid sweating and rapid pulse also, blurred vision, pale appearance, slurred speech, dry and pale lips, and unsteadiness and irritability. So these are some of the factors that we can recognize a person is in a hypoglycemic condition. We have to react immediately. Now we will see the first aid treatment on how to react on a patient with the emergency care. So our main aim is to increase their blood sugar and their glucose content also. So if we increase their blood sugar or glucose content, they'll turn into the normal condition, and we also have to obtain the medical help. So what are the first aid treatment precautions and the monitoring parameters means? If the casualty is surrounded by the crowd, then request the crowd to move from there so that the person will get some air and also prevents the suffocation to them. The next factor is move the person to a cool place and make them sit in their comfortable position, and remove any extra clothes. It's like if they are wearing any other type of shrugs or coats, so removing such type of extra clothes. And also to check their bag for any sugar supplements so we can give them. And if they are not available, we have to give them any kind of fruit juice or sugary drink or glucose gels. And if the casualty feel better by the supplement, the casualty means the person who is affected. So if the casualty feels better by the supplement, then offer them more. Means we should offer the supplement in more quantity and let them rest in the place where they are until their condition recovers. And after some time of recovery, we have to ask the person if they are having any other glucose monitoring kits with them, or if they are having any other type of glucose monitoring kits. So with the glucose monitoring kit, we can check their glucose levels, and we can also write it in their writing pads. If they don't have any kind of glucose monitoring kits, then just leave it. And monitor their vitals like breathing, pulse and response until they recover. So these are the first aid treatment guidelines we should follow for a hypoglycemic patient. And coming to the other conditions, means if the casualty's condition doesn't improve, then call for the emergency help, and also monitor the vitals like pulse, breathing and their response rate until the help arrives. And also inform to their family members about their patient's condition by contacting them or by approaching them. And the most important precautions that we should take during the first aid treatment of a hypoglycemic patient are: do not attempt or make them to vomit. And if the percentage of the person is in unconscious state, means the responsive percentage of the person is in unconscious state, then check if there is no vomit or anything stuck in their mouth. So why we have to check this thing means, this thing or the vomiting or any other kind of obstructive substance may obstruct the breathing of the person. By this chance also the patient may not recover. So we have to check for any kind of vomit or any kind of obstructive substance. And for any kind of unconscious person, we shouldn't offer or we shouldn't give anything to eat or drink. And also check for the normal breathing, and if the patient or the casualty is not having the normal breathing, then we have to start the CPR with chest compression. So these are the precautions. This is the first aid treatment that we should give for a hypoglycemic patient. And thank you so much for listening to my presentation. And if you like my video, like, share, comment, and don't forget to subscribe, and please comment if you have any doubts regarding this video. And thank you.